Live talking about thyroid basics. So a thyroid 101, so to speak. And I'm going to address as much as I can in the 15 to 20 minutes that I dedicated for this Go Live session. And basically, I'm going to give you the most important things that you need to know about your thyroid health. So one of the crucial things that it's important for you to know, everyone has a thyroid, men and women. But 80% of thyroid dysfunction actually happens in women, not so much in men. And women are very prone to something called Hashimoto. Hashimoto's, it's an autoimmune thyroiditis and affects many women who have no idea whether or not they have this autoimmune inflammation happening and attacking their thyroid, because many doctors don't even bother checking the antibodies for Hashimoto's. So, that being said, there's multiple reasons why your thyroid could be imbalanced. And let's just focus on hypothyroidism, which is low functioning thyroid, because that impacts many more women than hyper-functioning thyroid, which is Graves' disease most of the time. So first of all, the thyroid gland is a very important gland. It's right here at the bottom of in the middle of your neck. It's very superficial. It's very small. It's probably a few centimeters, and it has two lobes, a left lobe and a right lobe. They're united by a little piece of tissue called an isthmus. So you can palpate easily a thyroid on an exam. You can palpate it on yourself. You can just put your fingers right here and swallow. And if you feel something big moving up and down when you swallow, that's probably an enlarged thyroid, then you should not be feeling that. So how do we know there's something wrong with the thyroid? Well, the thyroid is a gland that determines your metabolic rate. So the rate at which your macros, your protein, your carbs, and your fat that you eat is incorporated into energy, is translated into this energetic process. The effectiveness of that is determined by your thyroid. So obviously, when that is sluggish or hyper, there will be all kinds of imbalances and signs and symptoms. They go from head to toe, inside and out. So you are going to feel a lot of different things. So what do people feel when they have a thyroid problem? Well, they might feel fatigue. This is one of the top signs and symptoms of thyroid dysfunction, especially low thyroid. So you feel fatigue, your ability to generate energy and to expand energy at the same rate that you used to, it's no longer available to you, so you're not going to feel good. You're going to need to sleep more. So people that have thyroid issues usually oversleep, and they need a lot of sleep. And even if they need a lot of sleep, when they sleep 8, 9, 10 hours, they wake up, they're still tired. That is a sign. Now, of course, you could think you sleep a lot and you have sleep apnea, in which case you wake up not refreshed, but it's a different situation. So fatigue, one of the most important signs and symptoms. Number two, there's lots of digestive problems. You would have constipation, and that's one of the biggest things with thyroid dysfunction. When you have low thyroid, people get very constipated, and they try to combat it and do fiber and probiotics and digestive enzymes and magnesium. But bottom line, constipation could be a sign of low thyroid function. Then there's lots of skin and hair signs and symptoms like hair loss. There's increased hair turnover, which can happen with too much thyroid or too little thyroid. So your hair follicle is very sensitive to the thyroid turnover and to the energetic processes that are happening in your body. So if you lose a lot of hair, make sure you have your thyroid looked at. Dry skin. Dry skin is one of the hallmark symptoms of low thyroid. So constipation, dry skin, hair loss, fatigue, we got 4 signs and symptoms right here that might be telling you, hey, you know what, maybe I need to have my thyroid checked. And then there's stuff, obviously energetic processes. Who needs a lot of energy in our body? Right? Our brain needs energy. It won't work well. So your mental processes, your cognition, your ability to form new memories, to solidify your memories into long-term memories needs energy. So all these neurotransmitters, all these neural pathways that need to be activated, they need energy. So taking that energy from food and putting it into a form that's utilized by the brain, that's the thyroid. So people that are low thyroid, they're foggy, they're forgetful, they don't feel good, they feel kind of blah, they're not motivated, they're quite depressed, and they can have severe anxiety. So if you suffer from fogginess, forgetfulness, you blah, you have low mood, you're unmotivated, please have your thyroid checked, because that could be a thyroid deficiency. Temperature regulation, obviously very important. Thyroid determines that, and it's really intimately connected to it. So low thyroid will give you a lot of signs and symptoms, like you have very cold hands, you're always cold wherever you go, you carry a sweater with you, you get, on the opposite, when you have too much thyroid, then you warm, you flush, you have intolerance to heat. So intolerance to cold could be a very important sign and symptom of thyroid dysfunction. So please make sure you have that looked into. And last but not least, there's lots of mitochondrial dysfunction, which is the, let's call it the energy fuel cell for every little cell in your body. So if that's deficient, and part of it, thyroid is really important for, like I said, generation of energy. Well, imagine that your low thyroid will lead to some degree of mitochondrial dysfunction, which means that you might get achy all over in your body, and you don't know why. Sometimes there's weird joint pain, there's pain in your body and achiness, and that is one of the symptoms that might accompany low thyroid. There's something else that I'm forgetting, and it came into my mind that flew out. Let's see, headaches. Headaches are also a very important sign and symptom of low thyroid. I've had many times patients come in, they have some symptoms, everybody with headaches a little tired, they don't sleep well, they wake up with a headache, of course they gotta be tired. So sometimes a lot of the accompanying signs and symptoms that come around the headache are ignored, and people just focus on the headache. And you check the thyroid is low, please make sure you have a trial of thyroid therapy to make sure that the headache is or not responding to the thyroid therapy, because that could be what's causing it. And that's about it for signs and symptoms. Now, how do we diagnose thyroid dysfunction? Well, there's some labs that we need to order, and those labs are very simple. There's 5 major labs. TSH, it's thyroid stimulating hormone. Free T3 and free T4 are your 2 thyroid hormones. They're called T4 and T3 because T4 has 4 iodine molecules, T3 has 3 iodine molecules. That's what's different between the 2 of them. Otherwise, they would be identical. So there is an enzyme in the body called deiodinase that transforms T4 into T3. So 4 iodine goes down to 3 iodine molecules. This is your reserve hormone that doesn't engage with your cells. The T3 is the active hormone that engages with your cells, that's able to exert a cellular effect. So obviously you want enough T4 to be able to convert it to T3, but you want that conversion process to be good. So if you just measure T4, you wouldn't know if you're converting, if you're a good converter, if you're converting to enough T3 to actually impact your cells in a positive way. So we need to check both. Free T4, free T3. Do you want to check total T3, total T4? Sure. But those are the bound hormones that circulate bound by thyroid binding globulin. They do not interact with the cells. They're not able to interact with the cells. And thyroid binding globulin can be super high in many situations, in which case if your total T4 and T3 look good, and that's all you check, you're like, oh, great, I have good thyroid. But your free T4 and free T3 are abysmal, then that's what matters. So again, I don't really check total T3, total T4, because if I check the free T3, free T4, the ones that are able to interact with your cells, that tells me a lot more about your capacity to have normal thyroid or not. Number 4 and number 5 tests are very simple. They're the thyroid peroxidase antibodies and the thyroglobulin antibodies. Those are Hashimoto hallmark antibodies. So if you do have some kind of thyroid dysfunction, as a second step, you can check the thyroid antibodies. You don't need to check them right off the bat. But if you come in and you're like, okay, do I have a thyroid problem, doctor? Can you check my thyroid? These 3 things, the TSH, the free T3, free T4, should be the basis of the basic, the littlest amount that can be done to look at your thyroid. So if you, by any chance, have a doctor that just looked at your TSH, that is not a thyroid check. TSH is a hormone made by your pituitary, and it's technically supposed to be in response to low thyroid. So the lower your thyroid, the higher the TSH. The problem is that there is a different mechanism within your pituitary cells compared to your all over the body cells that detects T3. So when your T3 is low within your body, but it's low within the pituitary, it will preferentially enter your pituitary cells by passive diffusion, whereas into the body it needs an active diffusion transport, an active transport. So basically you can have low T3 throughout the body, but normal T3 in the brain. So your TSH measurement would not be an accurate reflection of what happens in the body. So doctors who rely on TSH only are prone to miss a lot of thyroid dysfunction. So they tell their patients, hey, I checked your thyroid is great. Don't take that for granted. If all that was checked was TSH, that is not a thyroid check, okay? And last but not least, let's not forget iodine. Remember I told you that T3 and T4 have 3 versus 4 iodine molecules? Well, you wouldn't have a thyroid if there wasn't any iodine, because without iodine, we all would have goiter, our thyroid enlarges, there's a lot of TSH which drives growth of the tissue around the thyroid that really produces nothing because there's no thyroid hormones without iodine. So iodine deficiency, it's a big cause for thyroid deficiency. So obviously checking iodine would be one of the things you want to do. Iodine deficiency is not just drawing the blood and testing your iodine. Most people would be deficient if you tested that way. There's an iodine challenge test, which is probably the gold standard of checking iodine deficiency. Basically, you ingest 50 milligrams of iodine in the morning, you collect the entire urine that day and that night, and in the morning, the first urine of the morning, and then you submit it to the lab will analyze it and say, oh, okay, well you peed out 47.5 milligrams, you only retain 3 milligrams of iodine, you don't need iodine. But on the other hand, if you peed out 25 milligrams out of 50, you retain 25, that's probably your dietary daily need for iodine. So we talked about the symptoms, we talked about testing for iodine. Well, you find out your iodine is, thyroid. You find out your thyroid is low. What are we going to do? Well, again, number one, test for iodine. Your iodine is low. We need to correct the iodine deficiency. That would really spur on and hopefully help your thyroid. Your thyroid and your adrenal pretty much go hand in hand, and it's very important that you understand that if the adrenal is not balanced correctly and you only focus on the thyroid, that is not going to impact the body well. So ideally, a doctor who determines that you are thyroid deficient would also look at adrenal, will look at your sex hormones. Interestingly enough, because your body's energetic needs are dependent on not just the thyroid is a big one, but your sex hormones. They're really important for your energy. And women who are going through menopause, they know exactly what I'm talking about. Once your estrogen tanks, your energy tanks. So your thyroid will then work in overdrive. And your thyroid might look pretty bad on the blood test because it's working in overdrive. Your body doesn't have enough thyroid hormone to do what it needs to do. It needs to get its energy from somewhere. So your thyroid won't keep up with the demand. So it could be low, but that's because you are in a funk with your estrogen. So long story short, looking at the body as a whole to understand if there's something else determining or contributing to the thyroid dysfunction is crucial. Nothing in the body works in a vacuum, and the thyroid is interconnected to all your other hormones. So sex hormones, adrenal hormones, insulin, cortisol, all of that has to be looked at. So we looked at all of those, there's no problem. It's just low thyroid. So what do? Well, we can consider thyroid replacement. That would be gold standard therapy for patients who have low thyroid. So what is the best thyroid replacement therapy? Conventional medicine loves Synthroid. Synthroid levothyroxine, it's the T4 I told you about, the one with 4 iodine molecules. Well, like I told you before, this is an inactive form. It's like me putting money in a savings account and putting a hold on all that money and telling you, well, I gave you $40,000, but you can only use $2,000 a month. Well, wait a minute, doc, I can't pay my rent, I can't pay my bills, I need more than $2,000. Well, that's fine, it's just gonna stay right there in this account, and I'm gonna put stuff in it, you're gonna keep growing it, 40,000, 50,000, 60,000, we're gonna use a little bit at a time, but you can't use it. So it's the same concept. The T4 will eventually go out of your body, but you keep introducing it, and you hope it's gonna drive more and more conversion into the T3. There are patients who need to consume massive amounts of T4 in order for their body to convert to the appropriate amount of T3, and that can happen sometimes. If you force a lot of stuff into it, the body will eventually give you the right amount of T3. It will always look like you have a super suppressed TSH, the little pituitary hormone I told you about. It confuses the clinical picture, and patients don't feel any better. They're still tired and achy and foggy and depressed and unmotivated, and they can't lose weight. I forgot about the weight gain that happens with low thyroid. Oh my God, that's number one symptom. I totally forgot about it. So anyway, obviously you get it. You probably knew about it. But yeah, weight gain is a big one. So T3 should be incorporated into the therapy of anyone who is a poor converter. How do you know you don't convert T4 to T3? Well, it's very simple. You start the T4 therapy, you check it, your T3 went from 2.5 to 3.5, you're great, you're converting, everything looks beautiful. There's no way we can measure the activity of this specific deiodinase enzyme, but we can look at the T4 and T3 before and after the therapy. And if the T4 went up and the T3 stayed the same, you're a poor converter. So what impacts the deiodinase enzyme? B12 deficiency, selenium deficiency, magnesium deficiency, B-complex vitamin deficiencies, and iodine deficiency. So by correcting vitamin status, we can always improve the activity of the iodinase and help someone become a better converter. That being said, we have free T3. It's available. It's called liothyronine, and it should be considered in combination with T4, in my opinion, in the majority of patients. There are people who are very sensitive, and they might be sensitive to T3. And once in a blue moon, you have somebody who has palpitations and anxiety and too rapid of a heart rate in case they get T3 only, or their T3 levels are too high. And I've even seen one or two patients occasionally who have, unfortunately, an episode of atrial fibrillation because of too much T3. So their body just can't handle it, can't tolerate it. So you have to back off, you have to decrease it, you have to start with the T4 again and then titrate to what's their dose, what can they tolerate. So long story short, Armour Thyroid is also available. The difference between synthetic T4 and T3 combinations is that usually people start out with a lot of T4, then bring in a little T3. The ratio between T4 and T3 is not in the favor of T3. It's in the favor of T4, like 10-to-1 or 8-to-1, whereas in nature, our ratio is totally different. So the pig thyroid, it's a ratio in which T3 is stronger. It's much better represented than what we get with synthetic. Obviously, you can mimic some of that by using very little T4 and just adding up the T3 till the patient's symptoms improve and the levels look good. But most patients prefer, and they get a better response, on Armour Thyroid or MP Thyroid, which is a desiccated porcine glandular product. So that being said, the doses are vary from 25 milligram to like 150 or more for Synthroid. I've seen patients on 200 milligrams of Synthroid. Again, at that point, it's just driving a lot of T4 into a body that doesn't convert it very well. T3, usually people don't need more than 12.5 a day. I've had occasionally patients who use 25 milligrams of T3 and that's it. That's all they use. But that's unusual. Most patients do well on Armour, and between, I'm going to say 50% of patients are somewhere between 60 and 120 milligrams of Armour. Once you need more than that, like 150, it means your thyroid is shot. It's totally not working, and you need total and complete replacement. And there are people who are going through chemotherapy, who have major stressors in their lives, who have had radiation and their thyroid is responding to the radiation not working. You have to give them more until you see them over the hump. And then eventually they're like, oh, you know what? I have palpitations, anxiety, you realize the thyroid is coming back, and then you have to decrease the dose. So monitoring the labs carefully and talking about symptoms, it's also something that your doctor should be doing. So thyroid is one of those things that, hey doc, can you just give me my refill? I'll see you next year. It's probably bad management. You really need to understand, once you're on a significant amount of thyroid replacement, your body cannot naturally adjust on its own. And if something happens, you get sick, you started exercising more, you became sedentary, and you stop exercising, your thyroid needs will change. If you're not going to see the doctor, your medication is the same. Now you have either too much or too little thyroid. So anytime you have something impacting you that will also impact your energetic processes, you don't sleep as much, you eat more, you eat less, you exercise more, you exercise less, you have more stress than usual, your sleep is disturbed, you have more anxiety, you have more depression, you always need to see the physician and have your thyroid checked to see what the medication looks like. Does it need to be adjusted or not? So that's pretty much all I had to do or say about Thyroid 101. Hopefully this was useful. It's always good to have patients get a little bit of education, all like this in a very quick, 25 minutes? So if you don't have any questions, well, thank you so much for being with us live, and we appreciate you, and we are coming next week with... What do we have next week?
Let's see. It is the uterine prolapse, February 2nd.
Okay. Next week we'll talk about, as we approach Valentine's Day, I'm going to focus a little bit more on sexual wellness, urinary wellness. So I want to talk live about prolapse and pelvic floor weakness, because many women suffer from that and they don't have any idea until it's too late. And hey doc, there's a lump down there, I have a lot of pressure down there, I lifted a furniture and something popped up. So we want to talk about that so that doesn't happen and that's not you. So I'll see you next week.